Hi guys and welcome to my channel. Myself Dr. Akshay, and in today's session I'm going to be explaining about the topic clinical methods for measuring systolic blood pressure and diastolic blood pressure. If you guys want to learn more about the circulatory system, then click subscribe and the bell icon. So let's do this together. Coming to the topic clinical methods for measuring systolic and diastolic blood pressures. So this figure shows the auscultatory method for measuring systolic and diastolic blood pressure. Here you can see a stethoscope is placed over the antecubital artery and an inflated cuff is placed over the upper arm. So this is the inflated cuff and this is the stethoscope. As long as the cuff continues to compress the arm with too little pressure to close the brachial artery, no sounds are heard from this antecubital artery when we are measuring with this stethoscope. However, when the cuff pressure is great enough to close the artery during the part of arterial pressure cycle, a sound is heard during each pulsation. These sounds are known as Korotkoff sounds. This sound was named by Russian physician Korotkoff in 1905. Korotkoff sounds are caused by the blood jetting through the partly occluded vessel and vibrations of the vessel wall. The jet flow causes turbulence in the vessel beyond the cuff, and this turbulence creates vibrations which are heard through the stethoscope. In determining blood pressure by auscultatory method, the pressure in the cuff is elevated above the arterial systolic blood pressure. As long as the cuff pressure becomes greater than arterial systolic blood pressure, the brachial artery will remain collapsed. When the brachial artery remains collapsed, no blood will jet into lower artery. So at this point, no Korotkoff sounds are heard through the stethoscope. This is because at this particular point of time, no blood jets into lower artery during the pressure cycle. So as soon as the cuff pressure is reduced gradually, the blood will start to flow. At this particular point of time, the pressure will fall just below the systolic blood pressure. You can see the point B. This is that point. At this particular point, this cuff will become loosened and blood will start flowing through this lower artery. When blood starts flowing through this lower artery, you can feel the pulsations through the stethoscope. These pulsations will be in the form of tapping sounds from the antecubital artery, which is in synchrony with the heartbeat. At this point, the pressure level, which is indicated by manometer, will be equivalent to systolic blood pressure. When the pressure in the cuff is still more lowered, this Korotkoff sound changes its quality. And finally, when the pressure in the cuff is lowered still more, the sounds which are heard through the stethoscope, that is Korotkoff sounds, will change in its quality. That is, at point C, it will become a muffled type. So at this point, we can hear this diastolic blood pressure. That is a kind of muffled type of Korotkoff sound. So see this graph. This graph shows the normal systolic and diastolic blood pressures which are measured at different ages. So here, this progressive increase in blood pressure results from the effects of aging on blood pressure control mechanisms. So here, the progressive increase in blood pressure results from the effect of aging on blood pressure control mechanisms. Here, you can see a slight increase in systolic blood pressure occurs after 60 years of age. So this is a 60 year of age. After 60 years of age, you can see a slight increase in systolic blood pressure. This increase results in decreasing the distensibility of arteries or hardening of arteries, which is due to arteriosclerosis. So next, coming to the concept called mean arterial pressure. So mean arterial pressures are the arterial pressures which are measured millisecond by millisecond over a period of time. This mean arterial pressure is not equal to the average of systolic blood pressure and diastolic blood pressure. This is because at normal heart rates, a greater part of cardiac cycle is spent on diastole than in systole. Thus, the arterial pressure will always remain nearer to diastolic blood pressure than to systolic blood pressure during greater part of cardiac cycle. The mean arterial pressure is determined about 60% by diastolic blood pressure and 40% by systolic blood pressure. As you can see in this figure, this mean arterial pressure is always nearer to diastolic blood pressure than to systolic blood pressure. Here you can see this is the mean arterial pressure. This is always nearer to diastolic blood pressure than to systolic blood pressure. This is the systolic blood pressure. This is the diastolic blood pressure, and this is the mean arterial pressure. This is always lying near to diastolic blood pressure. And you can see one more thing, that is, at high heart rates, this diastolic blood pressure comprises of a smaller fraction in total cardiac cycle. You can see this diastolic blood pressure at higher heart rates comprises very small fraction. So that covers the topic clinical methods for measuring systolic and diastolic blood pressures. I hope you guys learned about this particular topic. Thank you so much, guys. Love you all, guys. See you guys in the next session.